Hey everybody, Ryan McMahon here today. Thank you for a briefing. Normally on Mondays we do a briefing at the On Center. Today I am at my home office. The reason being that I have had uh, exposure to COVID via a family member. I was a contact, so I'm in a quarantine. I feel fine. I've tested negative for COVID, and certainly as county executive, if I wanted to work out of my office, I could. But the safe thing to do for stopping any potential spread is for me to continue to stay home for a couple more days and continue to watch my symptoms. So I will be doing these Facebooks for the next few days and maybe even Thursday. So what we'll do is we will give our briefing. I will get on a Zoom call with the media. We'll answer questions, and then obviously they will report on that. And it's been a busy day. It's been a tough, busy week. Hopefully, everybody had a safe Thanksgiving and was smart and safe. The virus is in the second wave. We've had increased level of cases because of the increased case level, even though we've flattened. Remember, the first week of November, we grew from week 1 to week 2, 90% in cases. Week 2 to week 3, of about 9%. Last week, we grew about, I think it's around 5%. So we flattened out our case averages, but with more cases, where our hospital numbers are becoming an issue. And certainly, loss of life has happened. And I'm very sad to report we lost a female in her 70s in a hospital, and New York State has updated their website, and we've lost 2 more members of our community in a nursing home. So certainly, these are our neighbors. I want to think about them, think about their families, and please keep them in your prayers with me. Testing, we had light testing days over the last few days with the holidays. When I say light, I mean 2,600, 3,500 tests. Still more than what we were doing in the beginning of the pandemic, but each day we've been averaging really over more than 5,000 tests. With light testing days, we don't get the large sample. We've seen our positive rates go up. Our 7-day average right now, 4.6%. We expect that to start to level off and go down as we pick up testing throughout the week. Looking at our hospital numbers, 145 people in the hospital. Again, they've increasing. Hopefully they're going to level off. We've seen active cases between 5 to 8% of active cases have ended up being hospitalizations. The time it takes when someone is hospitalized to discharge for a regular hospital stay is still a little bit between 4 and 5 days. In an ICU stay between 6 and 7 days. But the reality is people are getting sick and they're going to the hospital and they're needing to get better. Certainly the therapeutics seem to be better, but when you look at 145, that's up 13. To give you an idea, we had 26 people go into the hospital, new admissions, 12 people discharged. So people are getting sick, and that's why we need to modify our social behavior. Looking at ICU, 26 in the ICU, that's up 3. New cases, we've had 10,473 positive cases, up to 112, so slightly less than yesterday. But again, that's been the consistent caseload. We have staffed up and we are catching up on these investigations with our health teams. But certainly we are concerned to see what will happen from Thanksgiving, Black Friday, moving forward on new caseloads. Testing, again, at the FSHAD for symptomatic testing, register ongov.net/Cayuga Medical, Monday through Friday, 9 to 1. Asymptomatic testing, 7 days a week at the On Center, covid19.ongov.net. Pre-register, you can get an asymptomatic rapid test at the On Center. Again, we've built up capacity there. People are taking advantage of this. It's a good a tool to go get a test. Looking at asymptomatic community testing, we're now looking at targeting zip codes and doing what we've been doing at the On Center, bringing it into zip codes so we can get better testing samples. so we can test some of these positive rates that have led to orange and yellow zones to see if it's just because we're just doing symptomatic testing, why the rates are high, or the rates are high because there's a lot of sick people there, and we need to look and further plan. So looking at that, Wednesday we're going to be offering asymptomatic testing in these areas in the community. We'll be back in the 13204 for Hamilton Street Boys and Girls Club on Tipperary Hill. McChesney Community Center, 13208. Again, for the city residents, anybody in the city can go pre-register at covid19.ongov.net, and you can get a slot to test here on Wednesday. We are going to be in the town of Clay at the Senior Center on Route 31 on Wednesday. Again, covid19.ongov.net. This will be for zip codes 13041. And then we will be at the Sewell Branch Library on Springfield Road in the 13214 zip code. Again, on Wednesday, please pre-register covid19.ongov.net. The hours are going to be 9 to 3 at all those locations. We cannot allow walk-ups because we do need these pre-registered so we can get through as many people as possible. Today, I had the opportunity to be on a call with the governor, his briefing with my colleagues and hospital officials from throughout the state. We spent a lot of time over the weekend collectively working in on making sure our school testing plans, whether we're in a yellow zone, an orange zone, a red zone, or no zone, can go on so that we can continue to have in-person learning. The data has shown that the schools themselves are safe and safer than the community at large. So for many, many reasons, it's our goal to continue the in-person learning. Very happy that a lot of our feedback that we gave the governor made into new policy. So the yellow zone testing remains 20%, 2 weeks. If your positive rate is lower than the community, you get out of a yellow zone. Orange zone testing, 10% every 2 weeks for orange zone schools until you're out of an orange zone. And then if you move into a red zone, let's knock on wood that we do not. A red zone test would be 15% every 2 weeks in a district. And then that way, that is a continual basis to prove that transmission is not occurring at a higher rate. Last week with our yellow zone testing, again, 0.4%, well over 3,000 tests were done. So certainly to date, we have not seen lots of transmission, if any, in the buildings. Today we started orange zone testing in many of the districts. To give you an idea, we did orange zone testing at All Saints School, Holy Cross, Lyncourt, Hebrew Day, Jawonio, Living Word Academy, Most Holy Rosary, my alma mater, Onondaga Hill Middle, Cathedral Academy at Pompeii, Salve Middle, Montessori School, Fremont Elementary, and Faith Heritage. So we were in all those schools. We did over 2,089 tests. We had 2 positives. So again, looking at that, the positivity right there is next to nothing. Really important. Tomorrow is Tuesday. And tomorrow's schools, we will be, again, we put out a list to the media over the weekend on where we're going to be testing. Even though the city school district has gone remote for the week, we will be testing in many city school district schools tomorrow. We'll be at Dr. Weeks. We will be at McKinley. We will be at Meacham. We will be at Salem Hyde. We will be at Van Dyne. We will be at Ed Smith. We will be at H.W. Smith. We will be at Huntington. In addition to that, we will be at Holy Family. We will be at West Hill High School, ESM High School, Tecumseh, Moses DeWitt, Lyncourt, and Pine Grove Middle. We have made it a priority of our administration to get the testing done to make sure that our kids can continue to have a level of normalcy. They can go to school. They can be with their friends. They can be with their teachers. And this will help us continue to see the data to prove that it is still safe. Certainly, if we see upticks in schools, everything's on the table. but right now school has been very safe, specifically K through 8 school. So that is really where we are as a briefing. As the governor talks about the winter plan, we've been obviously focused in on hospital capacities, and a way to look at some of these zones will be, does the community have the capacity to continue to meet the need to treat its sick? And that will be worked into these zones, and that may help us with some economic restrictions being relieved, but it also could be a very honest conversation. If we don't have hospital beds available in the community, or they're stressed, it's very difficult not to have economic restrictions. So for us, what can we do to make sure that our medical infrastructure is sustained? Whereas right now we're having calls with our medical teams, in the emergency management directors at all of our hospitals, for us to continue to make sure we have this capacity to serve our sick overall. We need to continue to distance. We need to continue to modify our gatherings. When you look at the cases and you look at the contact tracing, the small gatherings have driven this really spike that we've been dealing with. So now we know that. Now we work on that. We continue to modify that so that some of the economic restrictions on our neighbors and on the neighborhood businesses can get removed. We are increasing testing capacity. We're going to go into these zip codes. We're going to test the positive rates to make sure that they're true. And we are doing that on our county level. And with all this collectively together, will help sustain our medical infrastructure. We'll flatten these positive rates and we'll start to drive them down. But we need to do this as a team. So saying that, tomorrow looks like a lighter caseload than today, which is good. But we need to continue to be diligent and work together. And any other news, we may do another one of these briefings tomorrow.